is easing its lockdown, but doctors are sounding the alarm. Death rates are among the highest in the world. Still, stores are reopening, with the government praising its vaccination campaign. At the same time as banning journalists from hospitals. Coronavirus wards are filling to capacity. But that's not the message the state wants to broadcast. Like it or not, the third wave is hitting hard. Hungary has the highest number of people vaccinated in Europe and one of the highest COVID-related death rates worldwide relative to its population. Healthcare workers say restrictions should have been in place sooner and should stay in place longer. Access to Hungarian hospitals for independent media to verify what's going on is almost impossible. DW met one doctor who dared to speak on camera about the situation inside. Our correspondent Fanny Facsar reports.
Soldiers monitor people checking into this hospital treating COVID patients. When we start to film the building, go there and do your TV thing over there. They ask us to film the parking lot. According to staff inside, the hospital is at capacity. One doctor has to take care of 10 COVID patients and oxygen is in short supply. These are just some of the claims we're hearing from inside the hospital from a doctor, but we cannot verify these claims as authorities have barred independent media from entering. That doctor is Gábor Zachar. We meet him after his shift. 120-hour working weeks are the average now, he says. But the Hungarian government says everything is under control.
We've heard a lot from the Prime Minister that those who get sick shouldn't worry, that they will be cured, that we have extra medical staff. But where are they? Every day we're left wondering, what did we not have time for today? What did I forget?
Most of his colleagues don't want to talk in public because they are worried about repercussions.
We need to reach the people, not to create panic, but to say, people, this is what this is about, and this is why you need to follow the rules.
In an open letter to the government, a large number of journalists requested access to hospitals. Prime Minister Viktor Orbán responded in a televised interview.
This is not the time to go inside hospitals and produce bogus videos and fake news.
Márton Béres is a photojournalist. He too would like to show what's happening in Hungary right now.
Stop filming the hospital. It's a public space, sir.
It's a very common situation, says Márton.
This affects the people who want to know the real situation inside the hospitals. We know that more than 300 people died today. It's our job to tell the story behind those numbers.
Meanwhile, many young people in Hungary are starting to shed their masks. Without knowing what's really going on in Hungary's hospitals, to them it might seem as if the pandemic is already over.
To shine a light on the situation in Hungary, Dorottya Sikra joins us. She's a senior researcher at the Center for Social Sciences in Budapest. Is it time to be easing restrictions, or is the crisis only getting worse?
Good afternoon. Well, my impression is that the crisis is still, not completely at its peak. In Hungary, we have extremely high mortality rates of COVID, one of the highest in the world, actually, of daily deaths, around 300 per day. So that would suggest not to ease restrictions yet.
Why is the mortality rate so high, if I can jump in there, when the government's doing so well with its vaccination drive?
Exactly, that's the other thing. We have a very high vaccination rate at the same time. But people who get into hospital, they are in a really terrible situation currently in Hungary. And these may be 2 to 3 factors, I would say. One of them is that the public health institution as such has been moved out. Its independence has been stopped in 2017, and since then it has been under direct political control. So this means that we are not getting enough information, and experts cannot really channel their ideas and their expertise into the system. So political decisions are taking the lead. Probably the other issue may be the general cut to the health expenditure in Hungary recently, not only recently, but particularly under the Orbán government. And the third one is the mass out-migration of healthcare staff from Hungary in the past decade.
How is the situation with these hospitals under military rule? Why is that, and how's that affecting the situation?
Well, yeah, hospitals have been put under military rule under the emergency situation. And this means that there is a direct control through direct political and military control over doctors, and also that they cannot express their opinions in the media freely, and the media is not let into hospitals. This would not directly affect the situation, how people are cared for, because our doctors and nurses are doing an amazing job there. But it limits the information that the public and the media may get, and that is, worrying whatever the situation may be. Freedom of information usually helps better decisions.
What's the situation like for regular Hungarians? I believe this is one of the only countries in the world to refuse any sort of extension of unemployment benefits in this pandemic.
Yes, the pandemic, as we know, does not only have health-related consequences, but also really severe social consequences. So in Hungary, just like in other parts of the world, many people, hundreds of thousands, have lost their jobs. But as opposed to other countries, including our fellow Central Eastern European countries, in Hungary, no extensions to the unemployment benefit system was made, which was the weakest actually in the developed world, even before the pandemic, with 3 months of a maximum length of unemployment insurance benefit. That means that after that 3 months is gone, you can or cannot receive some social assistance at a very low amount. And in general as well, about 50% of all unemployed people are not registered at all in the state system, so they are left without any public assistance when they are longer term unemployed. And this now affects a great bunch of people, especially those who have worked in restaurants, in catering sectors, and so on and so forth.
I also believe the government's used the crisis to push through emergency measures to make life harder for the LGBT community.
Yes, some of the emergency measures have not much to do with COVID itself, but rather the government's political intention to push through controversial measures, including, for instance, the ban of single persons to adopt children. And this is to counter gay couples' adoption possibilities. And the other one is that transsexual people were banned to change their sex in their IDs, which again does not have to do with anything with the pandemic, but rather an ideological intention of the government to celebrate traditional gender values.
Okay, we'll have to leave it there. Dorothea Sikra on the latest developments in Budapest. Thank you very much.
Thank you so much.
On the topic of mass vaccination campaigns and mutations, here's our very own Derek Williams with today's viewer question.
Is there a link between mass vaccination and mutation of the virus?
Like other pathogens, SARS-CoV-2 mutates constantly, and vaccines do have an impact on its evolution. but a less direct one than, for example, a theoretical antiviral treatment would, because the two work in different ways. Drugs work by wiping out an active infection, while vaccines work by preventing them from occurring in the first place. Wiping out an existing infection with a medicine applies a kind of scorched earth selection pressure. The only pathogens that survive are those like these with mutations that make them resistant to the medicine, and only they go on to spawn the next generation. That's why drug resistance is such a common problem nowadays, because we put pathogens under massive pressure to evolve quickly in a very particular direction, which is to grow resistant to a medication. By deploying vaccines on a wide scale, we're also having an impact on virus evolution, but a more subtle one. By making a lot of people resistant to infection, we can drastically reduce opportunities for a virus to spread. So we're also upping the selection pressure, but in a different way. When the supply of potential hosts grows limited because many people are vaccinated, viruses that have, for example, mutated to be more infectious, they'll have a clear advantage and will, on average, infect more people. That's why more infectious variants can supplant less infectious ancestral ones over time. And there are indications that this is happening in many places now with SARS-CoV-2.
Thanks for watching, stay safe, and see you again soon.